Welcome to another edition of the Invisible Wheelchair Interview Podcast. I'm Donald Grodoff, family coach with FamilyOCD.com, FocusedHealthyFamily.com, and of course, InvisibleWheelchair.com. In the Invisible Wheelchair interviews, I get the wonderful chance to interview some of the experts with obsessive compulsive disorders, professionals that treat OCD, people who are going through or have been through OCD, parents and caregivers of those suffering from OCD, and of course anyone that advocates for treatment of OCD. My goal of these interviews is to inform people on all aspects of OCD and bring about awareness of obsessive compulsive disorder. The content, information, resources, and ideas that are talked about and brought up here in these interviews are not necessarily the views and opinions of myself, Family OCD, Focused Healthy Family, and Invisible Wheelchair Podcast, and I always recommend to seek additional professional help in finding solutions for yourself. You can find out more about me at FamilyOCD.com, FocusedHealthyFamily.com, and InvisibleWheelchair.com. Today I have the great privilege of introducing you to Dr. Zurita-Ona, known to many as Dr. Z. Dr. Z is a licensed clinical psychologist in California. Her clinical work started first as a school psychologist and then as a clinical psychologist. She has significant experience working with children, adolescents, and adults in OCD, trauma, anxiety, and emotional regulation problems. Dr. Z is the founder of the East Bay Behavior Therapy Center, a boutique therapy practice where she runs an intense outpatient program integrating acceptance and commitment therapy, ACT, and exposure response prevention, ERP, to support clients getting stuck from obsessions, figuring out what they care about, and do stuff that matters to them. Dr. Z attends local, national, and international conferences on a regular basis in order to keep up with current clinical research and deliver up-to-date therapy services to her clients. In addition to her doctoral training, Dr. Z has been nominated as a Fellow of the Association of Contextual Behavioral Science. She's a graduate of the International OCD Foundation's Behavior Therapy Training Institute, BTTI, for the treatment of pediatric OCD and adult OCD. Her clinical work is primarily based on exposure and response prevention, the recognized frontline treatment for OCD, anxiety, and related condition disorders. Dr. Z is intensely trained in dialectical behavior therapy, DBT. Over the last 10 years, Dr. Z has been learning, practicing, and teaching acceptance and commitment therapy, ACT. Dr. Z is a behavioral therapist with a passion for evidence-based practices including cognitive behavioral therapy and acceptance and commitment therapy. Her clinical work is dedicated to helping all her clients get unstuck and live the life they want to live. Now, let's go to that interview. So Patricia, thank you for being here today on the Invisible Wheelchair Podcast. I've been looking forward to talking with you.
Thank you so much for having me. I am super excited to have this conversation with you and your audience.
So Patricia, what I was going to ask you, what I always ask my people I interview is to give a little bit of information about yourself, maybe how you got into this, or give us a little bit so my audience can understand you on a more personal basis.
Thank you so much for the question. If it's okay, let me share a personal story I had hundreds of years ago.
Wow.
I know, a long time ago.
Didn't think you were that old, but that's okay.
I remember very clear when I was a teenager how I witnessed people in my family at times getting trapped in their life by fears. Fears about making mistakes, fears about making the wrong decision, fears about upsetting others. And I have clear images about those moments in which I was surprised, shocked, disappointed to witness those things. Later on, I had my first panic attack in my early 20s. I was driving back after a camping trip. I had an amazing weekend in this pristine area. Was super happy to go back home. And when I'm driving on the freeway, next thing I saw is this humongous truck. And then quickly I had this image of myself dying in a car accident, and I saw myself covered in blood and everything. I start hyperventilating. I remember holding the wheel really, really hard with both hands while the truck was driving by. And I had to pull over. I just had a full-blown panic attack. This image of me dying in a car accident has been present in my life since then. Sometimes when I'm driving, sometimes when I'm walking on the street. But I think to me, one of the things that appreciate from those moments, although they were challenging to witness how people get shaped by fear, to have my first panic attack and to deal with different forms of anxiety, is that every person experiencing some uncomfortable moments, whether it's with images, sensations, feelings, worries, anxieties, and we really do the best we can to handle them. For me, I think in my life, I have seen how fear has shaped some of my family's behaviors in terms of what they can do, what they cannot do. And it's really hard when people organize their lives around fear. I think I have done the best I could to relieve my fear and relate to it in a way that doesn't block my life or doesn't hinder me from being the person I want to be. When thinking about anxieties, whether that's dealing with a specific phobia or with chronic worry or with OCD, it's all driven by fear. Fear about being misjudged, fear about this annoying image, this disturbing image that shows up in your mind, fear about a catastrophic thing happening, fear about being trapped in an elevator, you name it. All anxiety disorders, OCD, and trauma are certainly driven by fear-based struggles. My passion starts with my history, with my family history about how people deal with fear and my own experience having to overcome my own patterns and just to be the person I want to be.
So one of the reasons we came together here talking today is about your work in working with OCD and anxiety. And you use two different therapies, which one, my audience hasn't really heard much about, and that's the ACT therapy, and the way you combine it and work with ERP therapy, which we have talked about here on the podcast. What I was going to ask you is if you could do a good explanation of what the ACT therapy is.
ACT stands for Acceptance and Commitment Therapy, and it's called a third wave therapy, and it's blending the principles of radical behaviorism and mindfulness. ACT in a nutshell is all about learning to accept all the yucky stuff that shows up under our skin, these uncomfortable thoughts, uncomfortable stories, uncomfortable obsessions, annoying feelings that we may have, or disturbing bodily sensations. ACT also invites us to choose what is important to us, to take a look to our values, and to take action towards the things that are important to us, while taking along with us all that internal noise that shows up in our body and in our mind. So in that sense, it's very different than other approaches, because ACT is not about getting rid of the negative stories or getting rid of the anxiety or getting rid of any internal struggle you may have. It's actually teaching us how to make room for that internal struggle and still create a life that we want to live and take action towards that life.
Patricia, what I was going to ask you now is that we talked about you defined ACT therapy. What I'd like to know is how you work with combining that with the ERP theory, the exposure response prevention. In fact, what I might ask you to do is to quickly give just a brief description of ERP to remind my audience, because we've talked about it before, but and then talk about how it combines together and conceptually how it works together to help people with OCD, with anxiety.
When I'm thinking about ERP and exposure response prevention, I'm thinking about helping my clients and teaching people to approach a situation, an activity, a person, or an object they have been avoiding because of all types of fears or associations they are getting hooked on, and to decrease any avoidant behavior or compulsive behavior they are doing. So the response prevention, it stands for doing less of any compulsion avoidant behavior, and the E of the exposure, it stands for approaching and getting close and leaning towards those aversive experiences. We know it's the frontline treatment for all anxiety disorders. The research has been very consistent about that. It's highly effective for children, teens, and adults. And in ERP, most people are going to develop an exposure ladder, and you're going to be approaching each situation as you move in this exposure ladder.
Thank you for the explanation. That's wonderful. And now if you could tell how you blend ACT in with that to make it more effective.
I think ACT really can augment and amplify the power of ERP. There are many ways in which people are integrating right now ACT and ERP, right? I can tell you more how I do it and how I see it, but if you talk to any other ACT therapists, they may have a different take. Yeah, because the model is very flexible, right? Since it's more principle-based, not too much technique-based, but principle-based, so then every person can deliver their personal style. When I think about integrating ACT and ERP, one of the most amazing interventions I have seen is how ACT invites people to choose what matters to them. Really look into their values and what speaks to their heart and what's the stuff that they really care about, and build the exposure exercises from that place. So it is very different to ask a person to touch a doorknob because they have fears of contamination versus to ask a person in which way touching this doorknob will help your life. In which way getting exposed to this fear of germs is going to help you to be the person you want to be. Are you willing to touch the doorknob so you can be the person you want to be? So those are very, very different conversations, right? The frame of exposures within ACT, it's all about values. It's all about values-based behavior. So we don't ask clients to do anything unless it's related to their values, the person they want to be, how they want to show up in relationships, how they want to show up in their friendships, how they want to relate to themselves. So once you help people to figure out what matters, then you talk about all the blocks. And one of the blocks that shows up is all the avoidance and compulsive behaviors. And we look at how all these behaviors are affecting their day-to-day living. So the exposures are built under the umbrella of values, and again, helping people to figure out what matters to them, which is very different. In traditional ERP, you will basically go quickly, you do psychoeducation, then you develop an exposure ladder, and then you keep moving. Within ACT, you create a contextual frame. You create a frame of change. And the frame of change is helping people to identify our values, what we care about. And from that place, then we talk about willingness. And willingness is not just this fancy abstract word within ACT model. I think we do actually a lot of exercises to help people to make a personal choice to experience discomfort because it matters to them. It's very different if someone tells you, well, you just have to accept a feeling or just have to sit with that discomfort, versus I can check with myself, it's important for me to sit with this yucky stuff so I can show up to my partner as I want to show up. And I'm going to check and I'm going to make this decision a personal choice. So within ACT, the willingness component is more a personal choice that we invite people to take, and from that place of willingness to approach the exposure exercise. So within the ACT model, it doesn't matter if you're doing a big exposure, a small exposure. It doesn't matter where you start. What is more important is the intention and your approach to the exposure exercise you're going to be making. Are you approaching your exposures with white knuckles and tie or trying to power through it? Or are you approaching the exposure with gentleness as a personal choice? Acceptance is going to be uncomfortable, and yet you choose to do it because it's important to you, because it will help you to get closer to the person you want to be. So I think the context, again, in which we are building the exposure exercises are quite different within ACT versus ERP, traditional ERP.
So that leads me to another question, that when you talk about it's dealing with values. Now, I hadn't asked you if I believe you said you worked with kids. Have you worked with small kids?
I work with children, teens, and adults in my practice. The youngest client we had has been 5 years old with a dentist phobia, and yes, or above.
With the idea of values and dealing with values, it's a little harder, I would imagine, for a 5-year-old to conceptualize that for themselves. So how do you implement it and do you use ACT with a small child?
Yes, absolutely. I think, to me, if you ask me, ACT applies to all populations and across ages. There is no reason why ACT cannot be delivered to any person who doesn't want to stand up for something in life, who doesn't have aspirations, who doesn't want to create a life that is worth living. A 5-year-old, even though may not use the word values, they have wants, they have desires, they have curiosities, right? They have this curious mind. So I think with the kids, we do a bunch of games, right, to figure out what is important to them. Usually the question is, what's the stuff that you care about? In which way, doing this behavior is getting in your way, right? What's happening there? I think I have to say that the richest conversation many times in my work, they really come from the kids and with the teens. They blow my mind. They're extremely real. They keep me on my toes. But also I think I think sometimes the teens and the kids are more clear than adults about what's important to them. They just verbalize it differently. I think adults, sometimes we come with so much noise in our head, right? And we have been socialized to say the right thing, right? But I think the kids and the teens, right, when you do some exercises for values explorations, and you don't have to use the word, but the kids and the teens, they do have things that they want. They do have things that are important to them. They have stuff that they care about. They care about their families. They care about bonding. They care about being loyal. They care about being compassionate. So I think there's no reason why I cannot be applied with the younger ones. Again, I think in my practice, I do a couple of games or exercises to figure out what's the stuff that matters to them and in which way some of these compulsions or avoidance is getting in their way. Usually the responses I will get from the kids and the teens initially when I'm doing values clarification, the responses are usually about goals, right? Well, I want to have more friends, or I would like to go more to the park. Or the kids will tell you, well, I want my school to have more toys, or I want to have the breaks for longer time, right? Or I want to have a different type of lunch box. And it's a natural thing. But then from that, after the kids tell me this specific thing that they want, then I ask them, if you were to have that, in which way that's important to you? What's that so important to you about, right? So you have to unpack a little bit what's behind this want. And you will be surprised that you get from the kids and the teens. It's a natural thing when you start doing the work. You may get responses that are more focusing goals or activities, but our task is to unpack and go a little bit beyond that. And then you get the values, you get the stuff that they care about, and then you build your exposures from that place.
Thank you. That's very helpful. It sounds to me like it's a matter of it's somewhat of terminology. I mean, you when you talk to an adult, you go after wording that's different. When you go after a child, it's just different wording and how you, like you say, digging. I mean, you dig with an adult too, because I know from the work, even the work I do in anxiety, I have to kind of, I do a lot of becauses, I want this, or I do this because, and then they have to go deeper and deeper until we get to the point where they're coming out with what I call the I statements. I I deserve better, I'm not good enough, or that kind of stuff.
That's a beautiful way. I think if I can add one of the things, one key concept within ACT, we're always taking a look for clients. This may be a little bit technical, but what happens is that we have been socialized to say the right thing. We have been socialized to say what people expect to hear from us. So when we're doing values exploration, I usually try to do minimum 3 values exercises with my clients, not just one, because by nature, if someone asks me, Patricia, what's important to you? My brain quickly will respond with what they're supposed to be saying in that moment. When you have a variety of values exercises, it's actually so much more, it gives you a chance to step back and notice all that noise that may come up in your mind, a quick response. And you figure out, I think, with more clarity, what really speaks to you as individual versus what you have been socialized you're supposed to be saying. So I think pliance is something that we pay attention to. What am I really saying here?
Do you see, in looking at how you use ACT with ERP, do you see
Yeah.
a difference, I guess, in the results with ACT being part of ERP versus just ERP? I don't know if you've worked separately with those or did ERP first and then brought in ACT. Patricia, what other differences have you seen in the work you're doing with ACT and ERP?
Another big difference is that within the ACT model, you don't talk about exposure hierarchies or exposure ladders. You talk most about exposure menus. One of the things of a new research is telling us in exposure theory is that we don't need to have this hierarchical approach to the process of exposure. You need to have variability of settings and ways in which people are learning to get in contact with this aversive stimuli, the aversive experience. So within ACT, we capture the current research of exposure therapy, and in the work with clients, after we're creating the frame by exploring their values and we do willingness exercises, then we develop an exposure menu. Like when you go to a restaurant and you say, I want this burger and I want French fries. So then in our work, we develop an exposure menu, a values-based exposure menu. And then every single session, when your client comes, you hand to your client the exposure menu and the client choose what they are going to focus on that session. Of course, some of the values-based exposure exercises, we have to plan it because we need some props sometimes, or we need to commute to certain areas. If my client has fears of pedophilia, for example, and my client may have been avoiding an area where there are children, we may have to plan the commuting time. But in general, the clients are always in charge of what they are going to approach, for how long they are going to approach it, as steps towards their values. In the process, another radical difference is in the process of exposure. It's not this mechanistic thing of touch this, do this, see that. Actually, we're prompting more clients. What's showing up? What's your mind telling you? Can you notice the thought? How do you want to relate to that fear? How do you want to relate to that thought that says, what if I'm a pedophile? What if I contract cancer? What can we do in this moment? Are you getting hooked by the thought, or are you having the thought? So the exposures within ACT, the how-tos, they look quite different. They are more interactive, I would say. They look less mechanical because, again, while it's a research-based approach, more than the technique, it's the process in which you are helping people to get in contact with what they're scared of. I usually tell my students, our task is to prompt. We're prompting, okay, can you notice what's showing up in your body? Where is that located? What is the urge? What do we do with that? It's a natural thing that your mind, as a content generator and pattern making machine, is going to throw that. What do we want to do with that? Let's step back. Do you really want to engage in the compulsion? Why are we making these things? So you're prompting for how people are relating to that internal experience, which is a very different conversation when you're doing traditional ERP. As a therapist that has been training all the behavioral approaches, I remember when I was doing pure ERP, you develop the exposure hierarchy, and then you help people to get in contact with that aversive stimuli. It works, absolutely works. But what I think it has been extremely important within ACT is to add the values component, and also the process has created a different conversation in the room with clients. So I think that's another difference. The process of doing exposure is a little bit more engaging. You talk about values-based exposure menus. You build a lot of the willingness, and you're more interested in the process of how people are relating to these experiences more than the technique. If my clients are going with this approach of powering through, and you will see that when they're like, I have to get done, right? I have to get rid of this, I have to do it. That is not the approach that you want to build within the model. The approach you want to do is like, okay, it's going to be hard. I'm going to do the best I can with certain gentleness, right? We try to create that to the best we can, of course.
I appreciate that information, and we could talk about this probably all day.
That's true.
But I feel we probably need to start looking at wrapping up. Let me ask, is there any other message you want to get out to this audience?
The biggest message I try to tell my clients, and is one of the, I think, biggest learnings in my life, is that doing the things that matter to us is not pain-free or fear-free, but it liberates us when we start doing the things that we care about. So I think for all your audience, I want to encourage all of you to do the best you can to take steps towards building the life you want to have. And that comes with some fears, anxieties, and worries, because that's just part of the human experience. And yet, once you live the life you want to live, it's amazing. There's no way you will go back to the old ways.
The last thing I'm going to ask you is that to tell us a little bit about how people might be able to find you. And I know you've got a book out that you want, and you've got a class coming up. So if you want to talk a little bit, just a few minutes about that. And I'll also, just to let the audience know, I will have this information up on both the invisiblewheelchair.com and on my familyocd.com. So we'll have information in two places to find. But if you'd want to just say a few things about how they could find you and your book and your class, please do.
Thank you so much. And thank you so much again for having me. It was great chatting with you. People can find me on the website www.actbeyondocd.com. I am launching an online class for OCD in particular based on acceptance and commitment therapy. This class has 8 modules that are full of skills about how to create a life you want to live and how to move towards that while targeting OCD with exposure-based exercises. And my personal website is thisisdrz.com, where you will read a little bit more about what I'm doing. If you are a teenager, or you're raising a teenager, or you're a school psychologist or an occupational therapist, or you work in any capacity with a person, with a teen dealing with OCD, my new book is called The ACT Workbook for Teens with OCD, where I'm talking a lot about the choice point for teens to approach all these situations, people, activities they are struggling because of OCD. It's a workbook, it's full of skills. I also have an illustrator from UK that created 20 beautiful, super friendly illustrations for the teens. So I think if people want it, that's another way to get a hold of me.
Patricia, Dr. Z, as you like to go by, it has been a joy to talk with you, and I really appreciate you being part of this podcast for me.
Thank you so much, and thank you for all the work you're doing, putting the word out there and creating community with a podcast. Thank you so much, Donald.
This concludes this podcast. We really would appreciate your comments. Simply leave a comment at www.invisiblewheelchair.com. There, you're able to submit a comment that will help us determine future podcasts. If you or someone you know would like to be a guest on the podcast, please email don@invisiblewheelchair.com. Remember, there is a corresponding tapping recording for each of the podcasts, with the exception of the interview podcast. You can find these tapping recordings and archive past podcasts at www.invisiblewheelchair.com. Finally, there is relief for OCD, and we at familyocd.com and focusedhealthyfamily.com can help you find that relief. Again, you can contact us through those sites, familyocd.com or focusedhealthyfamily.com. You can also find us on Facebook at Invisible Wheelchair Podcast. You can find us on Twitter at InvisibleWheel1, that's the number 1, or at FamilyOCD. So thank you for listening. Keep tapping and transcending your life to new heights.